How substances can affect a baby. If you have been watching these videos in order, up to now all of them have talked about babies who need extra help eating, sleeping, or staying calm for any reason at all. This video addresses a smaller group of newborns, babies who are going through withdrawal from prescription drugs and other addictive substances. A lot of babies who go through withdrawal were exposed to substances in the womb, but some babies who need to be on certain medications after they're born will also go through withdrawal. Of course, many babies with feeding or calming problems were never exposed to addictive substances and are not going through withdrawal at all. As we've said previously, only watch the videos that you find useful or that apply to the baby or babies that you care for. One of the factors that can cause babies to have trouble with eating, sleeping, or getting calm is having been exposed to substances before they were born. Substances can affect babies in two main ways. They can cause withdrawal, and they can cause long-term effects. Because a mother shares her blood supply with her fetus, they also share any drugs or alcohol she takes in, just like they share the nutrients from the food that she eats. This means that babies whose mothers use drugs or alcohol during pregnancy, especially during the late stages of pregnancy, may experience withdrawal after they're born. Drug withdrawal is a reaction the body can have if a person suddenly stops using any addictive substance, such as certain prescription medications, other drugs, or alcohol after they've been using them regularly. After birth, babies may go through withdrawal because they're no longer getting the substance they were used to, just as an adult will go through withdrawal if they stop using an addictive substance. Are you or have you ever been a coffee drinker or a cigarette smoker? Have you ever stopped or tried to stop? What happened? Did you notice any changes? Did you get grouchy or shaky or headaches? If you did, you experienced going through withdrawal from caffeine or nicotine. Depending on what addictive substance a baby was exposed to in the womb, withdrawal can be dangerous if not managed properly. Babies are watched closely in the nursery and given medication when needed. The majority of babies will have no long-term problems, but they do need extra care and watching right after birth. Some babies are at risk for long-term developmental problems because of exposure to alcohol or certain drugs in the womb. These babies should be followed by developmental specialists so any problems can be noticed and help can be provided early. The focus of these videos isn't on long-term effects. It's on common problems in babies' first few months of life, problems that can happen for a variety of reasons. Whether you're caring for an infant for the long term or for a short time, there are things that you can do to help babies who are experiencing withdrawal symptoms. We also know that attachment in the very early weeks of a baby's life is very important for their long-term psychological health. Some of the symptoms of withdrawal can make it very difficult for babies to attach to their caregivers and can make it difficult for caregivers to bond with or even care for these babies. It is critically important for caregivers to provide all babies with nurturing and closeness and reassurance, even babies who seem to push them away. Babies who are going through withdrawal can be very difficult to care for. We hope the information in these videos will help you find ways to be with the baby and provide reassurance and security even in those difficult moments. But remember, you need to take care of yourself too. If you ever feel that you are unable to provide the care that a baby needs, it's important that you ask for help. Finally, a few words about addiction. Addiction is a real and complicated disease. If you're a mother who used prescription drugs, other drugs, or alcohol during pregnancy, please be kind to yourself and view the information in these videos as tools that you can use to help your baby. If you're a relative, other caregiver, or support worker, it's important not to be judgmental about the babies that we care for or their parents. We're all part of one team, wanting to do the best we can for the babies that we care for or care about. We hope that the information in these videos will help you to be able to do just that. Thank you for watching. If you've been watching in order, this is the end of the series of videos helping babies who have extra trouble eating, sleeping, or getting calm. There's also an appendix, One Mother's Story, in which this mom talks about some of her baby's experiences with going through withdrawal. Please watch or re-watch any of the videos as often as you like and share them with anyone else who might find them helpful. If you have any feedback, we'd love to hear from you.